What if the way you were breathing was infecting your performance, damaging your heart and your lungs? Today I'm going to be sitting down with Dr. George Dallam, researcher, professor, and elite-level triathlete coach who has spent years studying one radical shift, moving from mouth breathing to nasal breathing during exercise. Today in my conversation with Dr. Dallam, we're going to be discussing VO2 max adaptation, how to effectively incorporate nasal breathing into your training protocols, and even if you're not into fitness, how you could use breath training and nasal breathing to help reduce stress and improve sleep. So let's dive into the conversation. I hope you get a lot out of today's conversation with Dr. George Dallam. Thank you for tuning in to today's episode. Before we get started, if you could hit the like, subscribe, or follow button on whichever platform you're consuming today's show. Dr. Dallam, thanks very much for joining the show. I really appreciate you taking the time to connect. I know I'm excited for today's conversation to connect with someone who has such an extensive experience in academia and research, particularly sports performance, and also that has performed and trained and coached at such a high level as yourself. Just to kick things off, if you wouldn't mind sharing with the audience, what is the research that you've dedicated most of your professional career to?
So the last maybe 10 or 15 years of my career, I became interested in the idea that you could breathe through your nose exclusively while you were exercising. I got interested in that because as a very young man, I started swimming year round at 6 and swam through college and went right into triathlon when I had water polo and went right into triathlon when I stopped that, which about 1980. And some bike racing too. And so I always had these respiratory problems, lots of pneumonia, bronchitis, later on sinus infections, et cetera. By the 80s, I also had developed, at the time, what a doctor referred to as asthma. We started calling it exercise-induced asthma, somewhere around there. It wasn't until years later that we separated that concept out and said some athletes get this asthmatic response, which just means that your bronchi, the big tube going to your lung, constricts, so it becomes more difficult to move air, right? So I started developing that pretty severely in the 80s at some point, racing, doing triathlon. So all that led me to try to pursue the normal conventional avenues with physicians, et cetera. Nothing really seemed to be working for me. The drugs they were using to manage asthma, they didn't really have drugs to manage exercise-induced asthma at that time, and the drugs they were using to manage asthma were problematic. I did not like them. And in fact, they stopped using most of those drugs. So I just sort of, tried to figure it out on my own. So mostly that turned into breathing and exercising inside when I would ventilate heavily, like harder training sessions. Somewhere around 2005, I was sick and, it was a weekend. I wanted to be out training. I was just sick all the time with this respiratory stuff. And so I stopped thinking about it in the conventional ways and went on the internet, right? So now the internet is full of so much more information. But at the time, there was a little bit of information about this concept. And I came across two ideas that helped me tremendously. One was the idea of using a neti pot, or we would call it sinus flushing in the sciences, and not using that when I got sick, using that every day as a preventative, like the way that you brush your teeth. You don't just brush your teeth when you have a cavity, although I guess some people do. You try to brush your teeth all the time so you don't get a cavity. So I started using a neti pot that way. And I also came across this wacky post from a guy who was coaching, an engineer, who was very analytical, which made sense in my brain, where he talked about breathing only through your nose. And I had never heard anyone even think about that concept before. And at that point, I was a PhD and a professor at CSU Pueblo, 20-some years ago. So I started trying that. I found right away that was almost impossible, right? I would try to do my regular workouts. I would feel like I was suffocating, right, when I tried to do this. So as soon as I got a little bit into the workout where it was a little bit hard at all, even like what we'd call aerobic threshold work, I couldn't breathe through my nose. I had to breathe through my mouth. But I'm sort of a hard head and persistent. And so I kept trying, and I started realizing within almost a week that I was actually beginning to adapt, meaning that I could do a little more work. And so over the next 6 months to a year, I fully adapted, not to doing easy work or aerobic work, to doing all levels of work, breathing only through my nose. So some of them didn't quite reach their VO2 max, and others actually exceeded it, breathing nasally. Typically, they were the more experienced and more athletically inclined people who had actually done this even in their interval training, et cetera. And so overall, what we saw with this small group, we had 10 subjects, is that they could achieve a slightly higher mean level of work on a treadmill test where we go to max, right? Where the work just gets harder and harder and harder. And they were able to do that and achieve a very similar VO2 at that level of work. It's actually a little lower, but not lower enough to be significant. So the second piece of that study that we were really interested in was the idea of what would happen at what we call steady state. That means when you're running steadily at a hard effort. So we picked an effort that was roughly equivalent to a 5K effort in a trained runner, about 85% of your VO2 max velocity. And again, that varies depending on how well trained you are, but that was our way to try to approximate that. And they ran for 10 minutes at that pace after they did their VO2 max tests. And so what we saw there is that when they were breathing nasally, not only could they do the work without any increase in what we call acidity, we measured that by measuring lactate, right? They didn't have lactate levels, but at a lower VO2. On average, I think it was 2 or 3 mLs per kg, which means milliliters of oxygen per kilogram body weight, which is meaningful, right? Lower when they were breathing nasally. And so then we started realizing, wow, maybe this is why some of these athletes who fully adapt can perform a little better in races because they're more economic. So in physiological terms, economy refers specifically to this idea that when you're doing some sort of movement, let's say it's cycling or running, that you can do that movement with more or less oxygen consumption. So somebody who's more economic does that movement at the same power output, the same work rate, if you prefer, using less oxygen. So we say that they're more economic. Well, it turned out that the people who were these subjects, when they were breathing nasally in their tests, were more economic. Even at max, we saw that, but it wasn't a big enough effect to be significant, right? So why is that? Well, a thing that had already been known in the little bit of research that had been done around this topic is that when you breathe nasally, you don't breathe as much. Even at fairly low levels of work, where you can do it, right? Where even without adapting, you can do that. You could go out and say, walk quickly, breathing nasally. You don't breathe as much. And breathing requires a fairly large amount of oxygen. At maximum, it requires about 15% of your total oxygen consumption. And even at low levels, it requires like 3 to 5% of your total oxygen consumption. So if you don't have to breathe as much, that's less energy that has to go to those muscles. That then means less oxygen costs for the activity if you're doing the activity at the same work rate. So that's what our study sort of illustrated. Literally everybody who has looked at this topic has seen a similar effect, right? Where when athletes are able to do work breathing nasally without being uncomfortable, if they're adapted enough to do that level of work, they actually are able to do that typically with a lower VO2. And so that means that it's more economic. For those people who apply sports science to endurance sports, improving economy is one of the holy grail ideas, right? We all know that we can train and increase our capacities. But what gets lost outside of people who understand sports science is that we can also train to improve our economy. When you have the flu or you have, mostly for me, it was things like bronchitis and pneumonia, very frequent pneumonia. You typically take weeks, sometimes even a month if you have pneumonia where you don't train, right? So then you can't really keep progressing well if that happens. So I assumed that was why I got better. But then when we did the study, it started to become apparent to me that there's potentially, and I have to say the word potentially, because we didn't directly test subjects' ability to go out and say, run 5K all out. We saw this through their steady state trial that they were able to do using less oxygen. Potentially, that's the reason why you might even get a small performance improvement from this. So people who are interested in competitive endurance athletics, that's all they even care about. And I'm going to just say this quite openly. They're like idiots about this because they're not old enough yet, right? They don't realize that you don't give a shit about your performance when you're 65, excuse me.
Yeah.
You're 65. What you care about is, can I still go out and run, right?
Yeah.
I can stay healthy enough to still be able to do the thing I love to do, right? When you're 25, and you got your master's in science and you're coaching, you don't even think about that stuff. But you will start to think about it if you have 45 years in a sport, or in my case, 60 years in a sport. How do I actually breathe in a way that allows me to be healthy? So that to me was a bigger motivating factor than the performance, right? I'm very performance oriented, but the bigger motivating factor was I don't want to have things happen to me that happen when you breathe in a way that's likely to damage you. So that's the other side of this whole thing. Even if it didn't allow you to possibly perform a little bit better if you adapt to it fully, even if it limited your work and you didn't realize, wow, you can adapt to this. You could eventually, run all out, breathing
Right.
easily. Even if that wasn't true, it would be a worthwhile thing for most people because we have so many things that go wrong with us by virtue of the fact that we open our mouths and start to breathe. So, everyone says, well, that's a natural response. And that's true, right? When you run, CO2 level production goes up. You need to clear that CO2. The most efficient way to do that is open your mouth and breathe real fast. It's actually more efficient to get rid of CO2 when you hyperventilate, right? When you breathe shallowly, really quickly, that has to do with CO2's diffusion properties coming across the alveoli in the lung. It just diffuses amazingly quickly compared to oxygen. So you almost can't breathe too fast, right? Faster you breathe, more CO2 you're going to get rid of. But, that's actually not a good thing. The first thing that a mechanic would say to you is make sure you change your air filter. And I don't think they ever say, take your air filter out and don't even use it, right?
Mhm.
The reason they do that is because your engine will get damaged if you don't filter the air that's being drawn in to power it. Even though an air filter creates a little bit of resistance and you can probably get a bit of horsepower out of taking it out briefly, mechanics won't do that. They'll tell you you're a fool to do that because you'll damage your engine, right? So when we breathe through our mouths, so many damaging things happen to us. They happen slowly, right? They don't, I didn't develop EIB in a minute. It took me like years of hard racing before I realized, wow, my bronchi are constricting and I can barely breathe when that happens. It happens slowly, but that doesn't mean it's not important. So there's like a whole series of things that are now being better researched, right? We have a newish researcher. He recently finished his PhD program at Baylor and moved to a new school in Texas where he's a new professor. That means he's an assistant professor. And he's into this topic. His dissertation work and all the work around that with a bunch of his graduate school colleagues and probably colleagues at Baylor had to do with nasal breathing. And he's looked at a lot of different outcomes that are influenced by nasal breathing. So most people don't realize this. There's now a big body of literature on this topic of why and how nasal breathing is positive for you. So the most obvious thing is the EIB thing, the exercise-induced bronchoconstriction thing. In my day, a friend of mine, Randy Wilbur, who was the senior exercise physiologist at the training center, and I worked with a lot when I was national teams coach, he was very interested in this topic. And a guy who was there before me, Ken Runyon, I think his name is, he was also very interested in this. And they recognized that a lot of elite athletes have this problem. So they went out and did research to substantiate how many, because essentially the International Olympic Committee was pretty much accusing the United States of cheating by using bronchodilator drugs, which are ergogenic, meaning that they do increase your capacity for work if you have EID. And they wanted to substantiate that a lot of athletes actually did have EID, that they weren't just making that up, right? So they studied a lot of different elite athlete populations. And, in elite athlete populations in endurance sport, as much as 70% of athletes, that's particularly true in cross-country skiing, where everything is the worst, right? Where ventilation is phenomenally high and where the air is cold and dry, all of which creates damage. They were able to substantiate that, large numbers of athletes, like somewhere around 50% in triathletes, very high levels in cyclists, swimmers, et cetera, have this problem, and that it occurs at much higher levels the higher level of athlete you are. Well, now we sort of understand that what's actually causing it is just breathing itself, right? It isn't necessarily that, wow, you're just breathing bad air. If you breathe good air, you wouldn't develop EIB. Any kind of air, if you don't filter it before it hits the lung, is somewhat damaging to the lung. And the more that you do that, the more that you damage the alveoli, the more inflammation you create, the greater the likelihood that your nervous system will figure this out for you and stop you from doing that by constricting your bronchi, by making it hard for you to breathe at that volume of air. So you essentially teach your body this response. That's a whole topic. There's two ways the body tries to protect you. One is by constricting the bronchi. The second is by constricting the vocal cords. So we have these different variants now around this asthmatic kind of response. They require different treatment approaches. But why do they happen? Well, they happen because we're breathing high volumes of air that damages our lung. And all it has to do to damage the lung is be drier than the air in the lung, which literally the air always is, because the air in the lung is 100% saturated with water, and or colder. If you start throwing in things like chloramine gases in swimming pools or all the pollutants that are out in the outdoor world when we go out and cycle and run and things like that, viruses and every other thing that also can be damaging to the lung, it becomes this worst case scenario. What's most important to me is I have any number of friends and acquaintances whose hearts have been damaged. They have what we call cardiac fibrosis. Cardiac fibrosis is classically caused by ischemia, which means a lack of blood flow, which really means a lack of oxygen to the muscle. So when the heart is working, as it has to do continuously, if it doesn't get enough oxygen, a portion of that muscle can die. We call that in the broader term, a heart attack, a myocardial infarct, right? So these athletes who are supremely healthy, doing the thing that we believe for a long time was the best possible thing to do for your heart, endurance kind of athletics and training, have these fibrotic hearts. As a result of that, when the electrical wave that comes from the sinoatrial node, so most people don't realize their heart beats on its own, right? It's influenced by the brain and it's influenced by the rest of the body and the nervous system, but it has this underlying rhythm that it just generates itself. So this wave of electricity moves through and depolarizes the heart. It just means the electrons flux through the heart and change the polarities. That's what causes this contraction from the atria down into the ventricle to push the blood around the body. So when you put tissue in the myocardium, the muscle of the heart, where this electrical wave passes through, that's non-conductive, that interferes with that process, right? So we generally call that concept an arrhythmia. We develop arrhythmias where it's like it doesn't work properly. Something's off in the firing sequence, and there are hundreds of arrhythmias. But now the garden variety arrhythmia is atrial fibrillation, where the atria are not firing properly. It's not too scary, because there's gravity going on. If the atria doesn't fully contract, you still get most of the blood going down into the ventricle. Why it's scary is it sets you up for stroke risk, right? So that's why physicians always want to treat this, right? But we have no idea why these endurance athletes, they have these fibrotic hearts, right? And there's paper after paper written about this. This is maybe one of the most, vocal topics between cardiologists and exercise physiologists. Why are these people, why do they have fibrotic hearts? Plus, there's very little evidence suggesting that they actually die at higher rates. The best evidence suggests that the very fit people die at, the same very low mortality rates as moderately fit people, or sometimes even some evidence suggests that they do even better, that their mortality is lower.
Working hard but not seeing the muscle growth you want, taking collagen or protein might not be enough. You could be missing essential building blocks. That's why I'm excited to tell you about Body Health's Perfect Amino Tablets. These tablets provide all 8 essential amino acids in the perfect ratio for optimal muscle protein synthesis, recovery, and overall health. They're a game changer for anyone looking to build lean muscle mass, boost energy, and support healthy aging. Fuel your body with the best. Visit the Body Health link in the show notes and use code NEW20 for a 20% discount on your first order. Unlock your potential with Body Health.
What we're suggesting is that, and we've sort of demonstrated this in a variety of different types of research without looking at it yet directly, we're suggesting that when you breathe orally, as you reach higher levels of work, for those who are sort of endurance training familiar, past your aerobic threshold, where you start to get more acidic, your ventilation goes up disproportionately, you start to hyperventilate or have what we call hyperpnea, right? That you actually start to wash out your CO2. You not only don't maintain it, or you not only maintain it, you actually wash it out. It starts to drop. And that becomes very pronounced the closer you get to max. And that very likely is creating a relative constriction of the myocardial blood vessels, right? That simple idea of just breathing too much at really heavy levels of work. And maybe that's why these endurance athletes have these have this patchy fibrosis, right? So we really only know one way that a heart gets fibrotic, meaning it develops scar tissue, meaning that some tissue has died, been replaced with scar tissue. That's all that fibrosis means. And that's ischemia, right? It's the only really known way that we develop ischemia. Yet everyone's like, well, that can't be it because these people are super fit, right? They can't be getting ischemic hearts. But in fact, it might be that the way that most of us have chosen to breathe at very high levels of work is actually causing enough of that ischemia to have developed this fibrosis over time. Never super critical, like enough to cause an arrest where a significant block of the heart muscle dies, but enough to create patchy fibrosis over time and then create these arrhythmia problems later on. So, of course, when you breathe that way, you have to breathe slower. Do you ride a bike, Dan?
What's that?
Do you ride a bicycle?
I don't. I haven't rode the bike in a while. Yeah.
If you were a bicyclist, when you're out riding, let's say you're just producing a given amount of work or power, you have a choice. You can do that in really big gear, or you can do that in a really small gear. In a really big gear, you have to produce more force on the pedals, but you pedal slower. In really small gear, you have to produce less force, but you have to pedal faster, right? So that's kind of what we're talking about here. When you breathe nasally, you have to produce more force, so you have to pedal slower. You have to take slower breaths, right?
Earlier, you mentioned with the EIB that the mouth, right? That's part of what constricts the bronchi because the filtering mechanisms you're talking about. So there's basically no filter mechanisms to basically clean, dehumidify the air in the mouth as opposed to the nose.
Very limited filter mechanisms. You still produce mucus. You still produce nitric oxide. There's some capacity of the oral passage to pull some things out, but it hasn't evolved for that purpose, right? The nose is very evolved for that purpose. So the simplistic way is to say there's no. I won't say there's no. I'll just say it's vastly inferior, right? So from my knowledge of that anatomy. So as a result of that, you're now having to use this big gear. Well, one of the basic ways that we get cyclists to be faster is by using bigger gear, right? And at first, their legs get tired, right? And that's a whole discussion about peripheral and central mechanisms of fatigue. But their legs get tired because they're not used to that higher force, but then they adapt to it. And then before you know it, they start being able to recreate the kind of movement frequency they could in a smaller gear and they go faster, right? You're just training them to adapt to it. So, when we breathe nasally, that forces us to use that higher resistance, bigger gear. Right? When we use the appropriate levels of force by breathing nasally, we recruit our diaphragm very effectively, and we have very little need until we're working extraordinarily hard to recruit additional muscles, the internal, external, intercostals, et cetera, the upper chest kinds of breathing muscles. We do still use those even, when we ventilate, say at max, even breathing nasally, but it disproportionately switches us to a diaphragmic breathing approach, which nobody would argue is bad, right? Almost everybody would argue, in fact, we want to teach you that. When we breathe orally, it's almost like the opposite of what happens in that, environment with the rotator cuff. We use these really low forces, and we don't really need to access the diaphragm as much. So we start using this breathing that's chest dominated, using the upper body muscles. So that's non-productive on a whole bunch of levels. Again, there's so many tentacles of this that go out into how the whole body functions. And if you're thinking that's crazy, think about the fact that, breathing is the most core function, along with your cardiovascular function, that keeps you alive. Of course, it influences everything in physiology, cerebrally, muscularly, hormonally, et cetera, right? Even the immune response. So when we breathe using this nasal pattern, we start recruiting our diaphragm more effectively. Our whole pattern of breathing changes, and we do have to adapt to that over time.
Feeling stressed, overwhelmed, or just plain out of sync? I've got something that could help. It's the HeartMath Institute's Coherence Monitor. This incredible tool helps you track and improve your heart rate variability, leading to enhanced emotional balance, increased focus, and improve overall well-being. I use it daily to stay grounded and perform at my best. All it takes is just a few minutes of a guided session to start to feel the difference. Visit the link in the show notes to reclaim your calm with HeartMath. Can you define economy? Like, what are the measures or inputs that you're looking at when you define improvements in economy for an athlete or a runner?
So this gets confusing. There's two terminologies that are used. People talk about efficiency and they talk about economy. So economy is what we typically use in running because you can't measure the mechanical work of running very easily. Now we have devices that purport to do it, but they're really predictive devices. They don't actually directly measure it. So economy simply means how much energy you're using as measured via oxygen. Doesn't account for anaerobic energy, right? It's really just oxygen. So the idea is if you get more economic at a given running speed, you'll use less oxygen to run at that speed. And that means that there's more oxygen, blood flow available to go to your other working muscles, your skeletal muscles. So normally when you get more economic, it's not just, wow, it's easier to run at this speed. So now I can run a little faster, right? That's what economy ultimately translates into. Yep. And, that effect occurs across the full spectrum of intensity, all the way from the full spectrum of aerobically limited intensities, which is really anything past maybe 2 to 3 minutes. Probably even affects a quarter miler, because elite quarter milers amp up their aerobic system so quickly, they're even somewhat aerobically limited. Even if they're running like, what is it now, 43, 44 seconds, it probably even impacts them to some degree. So that's the idea of economy. Efficiency is a different idea, very related. Efficiency refers to the idea of mechanical improvement in terms of your ability to work. So we measure that in something like a bike where there's external work being done, or in the weight room, there's external work being done. You can measure that. And efficiency means that you can do that external work producing less work yourself, right? So it can be challenging to measure if you can't measure the work you're doing, right? And that's what we can't really directly measure easily in running, although, again, there are some pretty good predictive things, and some studies have been published around that, are still useful. So either of those translates into this idea. I can now move or produce work more easily. So not only have I increased my capacity to produce work, I can produce any given level of work more easily. Both of those translate into better performance, right? And, some of the countries that had very low rates of COVID were ones where they religiously use sinus flushing or neti pots. They don't use them when they get sick. They use them every day. Right. So if I inhale that COVID virus or rhinovirus or any other kind of virus, and it's caught in the mucus, there's normally a 1 to 2 day incubation period where it's trying to sort of take over the goblet cells and reproduce itself, right? It takes over their messenger RNA, if I have this correct, and reproduces themselves. So if you clear it out of there, right, in that period, even if you had a pretty good dose of, say, COVID virus come into your mucus passage, chances are it won't reach a critical viral load. So how do you do that? Well, A, just flush the mucus, and B, flush it with a substance in the water that you flush it with that's antimicrobial, right, that will actually kill the COVID virus on contact. So there's lots of stuff, even shampoo, but salt, all kinds of things will do that. So that's why these countries, a good example would be Tibet, where part of religious practice is a cleansing ritual using a neti pot. That's where neti pots really evolved from. So they don't get sick and then start using a neti pot like we try to do in this country. They just use a neti pot every day. That's why they don't get sick. There are a small number of studies, and now a couple have emerged post-COVID showing this, right? The upper respiratory infection rate is reduced when you habitually use neti pots. People are afraid of that because of a couple of publicized deaths where the connection between their using the neti pot and the fact that they died was very suspect. And that's 2 out of millions of users, right? Now, there are people who die in India and other countries where they use this a lot, where the conditions are very poor, and they will use water, right out of a water source that might be polluted, et cetera. Yeah, but we don't much do that in the United States. We largely chlorinate our water. So, and there are some people who would suggest that using an neti pot is somehow bad every day, but I've been using one every day for 2005, 25, 20 years, 21 years, something like that, literally every day. I try to use it the least amount, typically just once a day. I only would ever use it more than once if I suspect that maybe I've actually engaged in infection, like if I was around somebody who was sick, et cetera. But generally just once a day. And, I just don't ever get respiratory infections. When I was one of those people who got respiratory infections all the time, I literally just kind of stopped, right? So as I said, there are some newer studies that come out post-COVID showing this, both showing various agents that will kill the COVID virus on contact and showing the efficacy of daily use. Most of our research around that has been the way that we use it in medical practice here, which is that we start recommending that you use an neti pot when you already got the infection. Yeah. You're already expressing it through lots of mucus. At that point, those studies show you that it helps reduce symptoms a little bit, but it doesn't change things much. And of course, because it's too late at that point, right? You have to wash that virus out before it has a chance to really replicate the to high levels and then start to move through the rest of the body. When you breathe through your nose, what you do is push your tongue up and close your mouth off and then create the suction and the vacuum so that suction through the nose is improved. And again, what we've been able to demonstrate is even though you can move a lot less air through your nose than your mouth, when you're not adapted to it, as you adapt, you improve that ability, right? So one of the things that gets better is your ability to reach total ventilation. So, some numbers would be, low-level athletes maybe pull 150 liters at max, maybe 130, 150. Nasally, they might only be pulling 90 to 100 at first, but then later maybe they're pulling 110, 120. They're still ventilating quite a bit less. It's about 25% once they've adapted less. It's more like 35% when they're not adapted. But so there's still that benefit in terms of ventilating less, but the ability to transport oxygen is so much improved, right? So it's so much more efficient for a variety of reasons. The CO2 levels, the nitric oxide allowing better movement of air through the alveoli, the improved use of the diaphragm, allowing air to more deeply exchange with them along. All those things are improving breathing efficiency so much. You don't have to breathe more, right? Which is why you don't breathe more, right? Which is why it's beneficial. But you have to deal with that increased CO2 level, which just means you have to get used to it. So what does that mean? CO2 levels in our adapted athletes at max were just below where they would consider your hypocapnic if you had them at rest. But levels that people do achieve during exercise, even breathing orally on occasion, right? So it's not like they were excessively high. What is it, milligrams per deciliter, if I remember? I think it was a difference of like 35 or 36 milligrams per deciliter versus like 40. It's not that much higher. And your body can readily, we call it the chemo reflex, reduce its response to that. You just have to have regular exposure. This is basically how meditation works. Outside of the part about what you say in your mantra, if you use a mantra, mainly meditation just reduces your chemo reflex. And so that's good on not just being able to exercise, breathing your nose levels and protecting yourself by filtering your air. That's also good on a stress response thing, which is now everybody in the world, right?
Yeah.
So how does stress work? Well, if you don't like being in front of crowds and somebody says, get up and talk, you get a stress response. So all that means is your sympathetic system starts to activate, you produce more CO2, and then you start to sense that as anxiety, right? That elevated CO2, you start to sense, that's why people sometimes open their mouths, start to breathe a little bit, right? When they get stressed out like that. However, if you've got an improved, reduced, I should say, chemosensitivity, that little elevation in CO2 won't be as apparent to your brain. It'll still fall within norms. So you become less stress responsive.
Yeah.
That happens with exercise anyways, but it happens even more so if you exercise and breathe through your nose. So you stop responding to things that would normally create the signals that tell your brain, wow, you're getting stressed and now you need to get more stressed. And before you know it, you start breathing, opening your mouth and breathing really fast, maybe even eventually going to full-blown panic attack if there's some real significant thing that's creating the stress, like somebody's trying to kill you or whatever. And then as a result, you just wash all your CO2 out, which is, helps you to deal with it, but in the short run is, also very bad, right? Because you're really reducing blood flow to your brain, your heart, et cetera. So that's why people breathe through bags, right? When they breathe into a bag, all they're doing is rebreathing CO2. And that brings their CO2 levels back up, which then ameliorates the response, the panic attack response. So, the implications of having high CO2 tolerance, if you start talking about a way to better deal with stress, are huge, right? That's like everybody in the world almost is impacted by stress. Some people would argue that stress is the main reason. Other people would argue foods and other inactivity, but stress is one of the main reasons why we have so many health problems because we're in this constant state of sympathetic activation, right? We're very CO2 sensitive. We're very sensitive to things that produce that response. So we get overstressed really, really easily. So you reverse all that by meditating and reverse it even more by breathing nasally while you're exercising, adapting to that, in my estimation.
Do you wake up with dry mouth or have you ever been told you snore? Did you know mouth breathing can disrupt your sleep, reduce oxygen absorption, and even contribute to snoring? It's time to optimize your breathing with MyoTape from the Oxygen Advantage. This simple, comfortable tape encourages nasal breathing, leading to deeper, more restful sleep, improved energy levels, and better overall health. I've noticed a huge difference since using it myself. Visit the link in the show notes and use code GOODVIBES to get an exclusive listener discount of 5% on all products from the Oxygen Advantage. Sleep better, breathe better with MyoTape. It's been a total life changer for me. Your research has set such a good foundation for a lot of things I've incorporated with my nasal breathing, and it's helped drop my breaths per minute down drastically, which has in turn helped me feel less stress, helped me sleep better, helped me perform better. But it was quite a challenge and hurdle to get over some of the initial issues, especially with running, breathing through the mouth at night. But anecdotally, I mean, I could say that it's just been a total game changer for me. And everything you're saying, it just totally resonates and makes a ton of sense. But I've seen now the work in putting it through the nose and slowing down and being better at having this parasympathetic response. And my breaths per minute has dropped. I mean, typically at night, I'm somewhere between 12 and 14 typically. It used to be 16, 17, 18 breaths per minute at night. And so there's just been a big change in that adaptation and how that's related to my recovery, my ability to get deeper levels of sleep. And so, I greatly appreciate you taking the time to sit down and walk through the science of it and to really continue to stress the importance of adaptation, because those things do take time. It is challenging. It's like any other muscle movement or thing that anyone's ever learned or done in their life. It takes time, but the benefits are totally worth the reward. And I couldn't be more appreciative of you taking the time to sit down with us and talk through your athletic background, your credentials, the training, the work you've done, both personally and also professionally, because I know it's had a big impact on the sports science world and endurance athletes. But to your point, has such a huge impact just on anyone, right? Just the simple cue of going into the nose, slow down the breath, and the impacts that has on your ability to manage stress is hugely critical for anyone. What would you recommend? Is there particular source of training or program that you're aware of that you think people who are casually interested in this could potentially look at to maybe explore a little further? Or is it as simple as breathing in out through your nose and start slow and just gradually increase from there?
I will say there's an increased number of people who work around breath training. And if you feel like having somebody walk you through it would be useful, I won't make specific recommendations. And beyond Patrick, I can't really name people, but I'm aware of the fact that many people on the internet, Patrick McKeon, Oxygen Advantage. So he has all kinds of people who've certified in his process. And, I would always recommend them. But there are all kinds of other people who are basically now making their passion in work helping people learn to breathe more effectively. So again, some people do really well in that sort of environment. Like some athletes do really well in a coached environment, others don't.
I use the one that has an opening. I actually use Patrick's math tape style. I used to do the full coverage, but that in particular has been a great game changer and helped me, ensure that I stick to nose during the night. And that to me has also been a huge game changer as well. I did that before I started doing the training.
A lot of people have commented on this on the internet, physicians, et cetera. So the first thing it said is there's no research. There's only a small amount of research. One study that looked at basically just garden variety apnea, showing a reduction in apnea. Another study looking at people with more severe apnea, showing that some people with severe apnea will just try to puff through the breath. And so that scares everybody because they're worried that it could create a situation where you can't adequately oxygenate. There's no event of that, even though I would imagine millions of people are doing this now because the whole internet culture we live in now and the fact that became a popular thing a while back. However, I really emphasize a couple things. The first thing is, don't cover your whole mouth. Yeah. Use a myotape like Patrick sells or that you can buy otherwise, and just put a strip here because all you're really trying to do is hold the lips together. But if you had to puff, let's say you have severe apnea, you still will be able to do that, right? The main thing seems to be that apnea has to do with the positioning of the jaw and mouth falling open. So people can talk about this in a variety of ways, but for me, the main mechanism for that has nothing to do with body weight or anything else. It really has to do with how you're sleeping. When you sleep on your side, if you're a side sleeper, your mouth has less likelihood to fall down because gravity's going this way, right? Gravity is what causes your mouth to open. And when you sleep on your back, your mouth will literally always open. So if you're going to be a side or a back sleeper, you probably are better off taping your mouth. Yeah, just single strip in the middle, and which case you can actually breathe if you have to. It's mostly just helping your nervous system to keep your lips closed. It's not actually forming a complete seal or can't breathe. So what I would suggest to people who might be very tentative about this is that just try to do that when you're watching TV, right? Mm-hmm. So in a book I wrote recently, we talk about this test. It's actually validated. It's in the research where you just examine your ability to breathe nasally by creating a nasal breathing condition in a conscious situation and see if you're comfortable. If you have the sophistication to measure something like your heart rate, or even better, maybe your HRV, your heart rate variability, if you have that kind of technology, which a lot of people do now on their Fitbits and things like that, set that up, put some tape on your mouth, watch TV, try something where you're not really thinking about your breathing and see if you're okay. Because if you're not, you can just take the tape off, right? And if you're not okay in that situation, don't try to sleep, right? And you probably have more anxiety about it and you should probably work, with somebody examining you, maybe in a sleep study or something. But if you're fine doing that, I think you're probably okay to go ahead and try to take a nap. So maybe you progress to them taking a nap, right? The physicians now are very afraid, and it seems logical to them, if you close the mouth and the nose gets congested, you're going to suffocate, right? And that's sort of what the message is. But, one of the things you understand about how the nasal passage and the oral passage interact is that the histamine response that produces more mucus and kind of blocks the nose is very related to whether your mouth is open or not. And that probably evolutionary has to do with the fact that if you open your mouth and start breathing, then you're sort of protecting yourself by producing more mucus to your nose. Because well understood, and if you follow Oxygen Advantage stuff and back to the original guy that their principles are based on, why can't I think of his name? Buteco, right? One of their concepts was that you can clear that congestion if you just create a little bit of CO2 elevation or air hunger. So you just slow your breathing enough to create just a little bit of air hunger, and that congestion will alleviate. And it's been my experience. I don't know that anyone has studied this in a formal research, but it's been my experience that that's true, right?
Well, Dr. Dallam, I greatly appreciate the time and all the information you shared with us today. It was really great connecting. And again, I really appreciate all the work you've done with your research and everything you shared here today, because I think for anyone that hasn't incorporated these principles yet, they could be deeply beneficial in helping improve life satisfaction, not just performance in athletic context, but also with sleep, with managing stress. And to your point, just so many great other areas too in preventing illness. So thank you very much for your time. I really appreciate you joining the show.
It was good talking to you, Dan.
Yeah, you as well. You as well.